I decided to pursue my graduate degree in the public health program at UF because I've always had an interest in public health. So I've always had an interest in teaching people about health and how to improve their health so that they can live longer. I worked full-time during my MPH program, and I went part-time to the program. So I did 6 credits each semester, and so I did it in 8 semesters instead of the normal 5. It was difficult, definitely working while going to the program, but it was a great experience, and I was able to make a lot of connections. Where I worked was in the College of Medicine, and I worked with a lot of faculty in PHHP. I always felt supported. Talisha worked with me a lot to make sure my schedule would match with work and that it wasn't too hectic for my 8 to 5 job. Dr. Hart was my advisor. He was very supportive of me as well. So post-graduation, I actually stayed at the current job that I'm in right now, but that I also had through the program. I've actually been there for 5 years, and right after I graduated, I got a promotion and to a title of Education and Training Specialist 1, and since then I've actually got another promotion to a 2. So I've been at the same job, I really like it, and I feel like the MPH program really helped me in terms of getting a promotion and learning more about the public health field and applying that to my actual job.
So after I graduate, I will be attending medical school. Not too sure where I am going yet, but I do want to pursue a career in a primary care field. So when I was in undergrad, I always knew that I was going to go to med school, and then I fell in love with public health, and I realized that it's so important for me to get my MPH to understand the world better, healthcare better, and how I can be a better physician for my patients in the future. And so getting my MPH and just being able to learn all these different theories and models and stuff like that so I can understand human behavior. It's really important to me, and I think that I'll be able to use all that I've learned in my MPH to better the lives of others around me. For me, the biggest thing was the family feel. I knew from the moment I stepped on this campus, I felt special, I felt connected. Everybody went out of their way to make sure that I was truly welcome, and that started from the first day up until my last day on campus. Everybody here is really dedicated to making sure you succeed, and I feel like for a master's program, that's just so needed because all that support you get, it's going to take you so far in life.
My faculty advisor, Dr. Hart, has really supported me in my development as a public health professional. He's really contributed to my skills and my experience in the program, and has provided a lot of mentorship that I really value. With Dr. Hart, I came up with a research idea to him, and again, this is where that support came in. He really valued my initiative and allowed me to pursue that interest through providing mentorship and guidance on how to go about it.
So I think that the MPH program offered me a wealth of experience, and lots of memorable ones at that. But one that I really enjoyed was I was also the Public Health Student Association service leader. And so one of the things that we did was we actually put on a field day at the Boys and Girls Club. And we put on the whole thing, the entire student association, and it was just really amazing to see the kids come out. We brought them healthy snacks, we just played games, and it was just really great to bring everyone together. I really enjoyed it. It gave me an opportunity to learn a leadership role, to be able to delegate, and to also just really reinforce that we didn't just come here to get a degree. We came here to also share what we've learned and engage in our community. And Gainesville is our community. And so we were able to really give back from going to the St. Francis House, from the breast cancer walk to the field day. One of the main research opportunities that I took advantage of while pursuing my MPH was actually as a research assistant in the Department of Health Outcomes in Biomedical Informatics. And so really I worked with maternal and child health outcomes specifically. And there was a wide range of them, and so basically we looked at preterm birth. That was one of the main ones that we focused on, and it was just a really amazing opportunity.
The proudest project and activity that we've done in the MPH program that I'm most proud of is when we had to work on a project in our communication class to create a podcast poster presentation as well as a social media page focusing on either adverse experience in children, or we can focus on resilience. So just being able to put that together, the podcast, it was really exciting. And as well as to see my classmate being able to, even now we're still keeping up with the social media page. And the poster presentation was also amazing as well. That itself, the teamwork aspect into that was what made it my most proudest moment, to see everyone come together using their different skills set to really create something that was amazing.
Public health means the world to me. It has opened so many doors for my future. This was my niche. I wanted to study preventative medicine. I wanted to study it from a community setting, and I wanted to make a difference. I was looking for a university that, number one, had a lot of traditional values, had a lot of pride, and I always knew from the time I was a little girl that I wanted to be a Gator. When it came time to decide where I wanted to go for my Master's of Public Health program, I wanted to be part of the Gator Nation. I wanted to be a UF alumni. So in looking up their Master's of Public Health program, they seemed to hit the mark for me. They had everything that I wanted as a student, as well as an amazing group of professors that were there for me. They were able to guide me throughout this whole process and really listen to me. They offered me everything that I needed to succeed and then some.